Okay, now we're going to go over the parts of the heart. Alright, so we are looking at the anterior or front of the heart. If we turn it around, we can see the posterior portion of the heart. Alright, now that we're back to the anterior side, this red line right here is the anterior interventricular artery. Interventricular tells us that it is in between the ventricles. So this is going to be our divider line. Now the apex, or the point of the heart, is always the left ventricle. So from the apex up to that artery is all left. From the artery up is all right. So this is going to be my right ventricle. This will be my left ventricle. Now if we trace the ventricles up, we can see the atrium on top. So this is my right atrium, right ventricle, left atrium, left ventricle. Now these large blood vessels going in and out of the heart, this is the superior vena cava, which is going to bring blood, all the blood superiorly to the heart is be drained and enter the right atrium. Now the inferior vena cava is up underneath here, and that's going to take all the blood that's inferior to the heart and bring it back to the right atrium as well. Now they are blue because they are bringing used blood, low on oxygen, back to the heart. This is the pulmonary trunk, which houses the pulmonary arteries. Remember, arteries away. Arteries take blood away from the heart. Now they're blue, even though they're arteries, because blue indicates low oxygen. And they are. The blood in here is headed to the lungs, so it has not picked up oxygen yet. This large red vessel is the aorta, and that's going to take blood out to the body. And you can see here where it arches over is the aortic arch. All right, now let's turn it around posteriorly again. Here we can see the aorta curving on back down and beginning to turn into the descending thoracic aorta. Here we can see the posterior side of the superior vena cava. And now we can also see our arteries and veins. Now, this is the left pulmonary artery. And on this side, we have the right pulmonary artery. This is going to take that unoxygenated blood to the lungs, drop off carbon dioxide, pick up oxygen, and then it's going to bring the blood from the lungs back to the left atrium via the pulmonary veins. Now, pulmonary veins are red because now that blood is slapped full of oxygen because it just left the lungs. So this is my left pulmonary veins coming from the left lung, and these are my right pulmonary veins coming from the right lung. And again, they will both bring blood back to the left atrium. Now let's turn the heart back around, and we're going to take the front of the heart off. Alright, now we can see these white structures. These are my AV valves, atrioventricular valves, which tells us where they are. They're in between the atrium and the ventricle. Alright, so this is my right atrium. This would be my tricuspid valve. This is my right ventricle. On the other side, we have the left atrium, the bicuspid or mitral valve. Then we have the left ventricle. Now notice you can tell left from right by looking at the muscle mass, our lateral muscle mass. On the left side, we have much thicker muscle versus the right side, because remember, the right side is the pulmonary circuit, so it's not having to go nearly as far, versus the left, which is the systemic circuit. Here we can see the interventricular septum. Now, for our other two valves, these will be our semilunar valves. So if we look, guarding the entrance of the pulmonary trunk is the pulmonary semilunar valve. Then for our aorta, here if we look into the left ventricle, we can see the aortic semilunar valve. Okay, so let's go back around and we can see right atrium, tricuspid, right ventricle. Left atrium, bicuspid or mitral valve, left ventricle. Also, notice connected to the valves are the chordae tendineae, or heartstrings, and where they attach inside the ventricle is papillary muscle. And also, we can see all these trabeculae carnae, these uneven little bumps and grooves. And remember, these are genetic. Each one of us are unique in a pattern.